Hello, ladies. Good evening, and we want to thank God so much for this day. Tuesday was fun. How many of you had fun with the program that we had? I'm sure we all learned a lot. I personally also learned a lot. Thank you so much for granting me this opportunity. Thank you, Lady Agnes, and every lady, woman, mother here on this platform. Thank you so much. We want to do a little recap of what we learned on Tuesday. So if you remember anything, something new that you learned, something that you took home, you can please put it on the page and let's share. God bless you. Okay, so if you're not able to do a little experiment, trying to find how the structure looks, the structure of the vulva looks down there, you can do so. I just realized that aside the mirror and the phone, there's another fun way of exploring the place, and that is doing that with your husband. So, if you are fun loving, just as I am, this evening or any other evening that you get a chance, you can just open the slide where the vulva is, and then both of you can explore, learn the parts together. Who knows? All right, so tonight we'll be looking at disorders of the vulva and then the vagina. We'll be looking at what is normal when we come to the vulva and the vagina, and what is abnormal. We'll be looking at common disorders of the vulva and vagina. That is the causes, symptoms, risk factors, treatment, and then prevention. Now, the walls of the vagina secrete certain fluids or mucus, or some will come as we say a discharge. And this discharge, mucus or fluid, helps to protect the walls of the vagina and then the vulva. It keeps the integrity of the lining, makes it thick and healthy and elastic. Okay, now the hormone responsible for producing this fluid is called estrogen, and estrogen helps to maintain this balance. Okay, all right. Now, the fluid that is produced is so important because it helps the vagina and the cervix carry away dead cells and bacteria that are found there. So it's so important. That's why with every woman, when you take off your panty, you find this fluid or mucus or discharge in your pants. It is normal, it is healthy, it is very, 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 very important. It keeps the vagina clean and also helps prevent against infections. Vaginal discharge or the mucus or the fluid changes as we move through the month. It will change maybe in color, in texture, and in consistency too. Okay, now we want to talk about the changes as you move along during the month. Okay. Now let's start from when you have your period, day one. Let's say you have your period today, and let's say you have your period for 5 days, as most women do, some 7 days. And so you have to know what is normal for you. If you have a 28-day cycle, you know what is normal. If you have a 35-day cycle, you know what is normal. So let's assume that this is a 28-day cycle. Okay, so today I'm having my period. So from today up to day 5, I know that the discharge will be bloody, it's going to be red. There will be a lot of tissue being shed from the lining of my womb. Okay, so that is normal. You're having your period. Now, when you finish having your period from day 6 to day 14, let's say, yes, 8 days period, you'll notice that the discharge that will produce from the vagina is different. It's different. It's a bit cloudy, yellowish, and it feels very sticky. That is when the egg starts to develop and mature. the ovary starts to develop eggs and the eggs begin to mature. So the discharge from the vagina changes with that. Now, from day 14 to 25, that is when you'll be ovulating. Ovulating is the release of eggs from the ovaries through the fallopian tube to the uterus, that's the womb. Now, the mucus that is produced changes from being sticky and cloudy to it becomes thin and slippery like egg white. And God has a purpose for that. Now imagine if you have an egg in your womb and the vagina produces a thick and sticky discharge. The semen will not be able to go through the cervix to the womb. It will get stuck because the discharge there is so sticky. Now, God made the discharge at this point in time slippery and thin so that when your husband meets with you and he ejaculates, the sperm can easily slide through. It's slippery, so it will just slide through the vagina, through to the cervix, to the womb, to meet the egg. So it's so important. So if you want to know when you are ovulating, be checking. Some of us who don't use any contraceptive, this is a good way to check when you are ovulating, know when you are safe and when you are not safe. Ovulation discharge is thin and slippery and very clear. Okay, after ovulation, it goes back to being cloudy and sticky. Some few days before you have your period, the mucus from the cervix becomes light again. Okay, and then there's less discharge, then your period now follows. And then the cycle continues. You have your period. After your period, discharge becomes thick, sticky, yellowish, then thin, slippery, then thick again, then less, then the cycle continues. Okay. Now, there are some things that can affect the nature of the discharge that is secreted from the vagina. Now, certain things such as antibiotic use, there are some antibiotics when you use the discharge changes. Okay, and some infections, we'll be talking about them very soon, also change the vaginal discharge. Some birth controls, cervical cancer, diabetes, douches or douches. Many of us do that a lot. We buy certain concoctions, put it in cotton and insert it into our vagina. It's a no-no. Some scented soaps, lotions, bubble bath. You fill your bathtub with water and then you lay in for a very long time. It can affect the discharge that is produced by the vagina. And then there's something that we call vaginal atrophy. That is the thinning and drying of the walls of the vaginal membrane. That also is associated with menopause. It can also affect vaginal discharge. Once we are talking about discharge from the vagina and things that can cause vaginal discharge to change, there is an opposite side to where some women can experience dryness in the vaginal area. As we said earlier, the hormone estrogen is responsible for maintaining the fluid balance in the vagina and then the vulva. So when there is a drop in estrogen levels, it reduces the amount of moisture that is available in the vagina. There are certain factors that can cause this. One that I think most of us can relate to is childbirth and then breastfeeding. Now, during these periods, estrogen levels are very, very low. And other hormones, like when you are breastfeeding, prolactin surges, During child and pregnancy, progesterone surges and estrogen levels come down. So there's a likelihood of you experiencing dryness during this period. So that is normal. It will correct as time goes on. Another factor that can cause vaginal dryness is menopause. And I'm sure most of our mothers will be experiencing that. I remember when I was in community practice, you have women, around 50s, 60s, coming in asking for um, help in this area because they can't enjoy sex. The place is dry and they can't enjoy sex. Sex becomes painful for them. Yes, but fortunately, there are remedies for that. You have lubricants, you have vaginal creams that you can use for that. Okay. Now, another factor is chemotherapy or radiation during cancer treatment. And these can also cause vaginal dryness due to estrogen levels dropping. And then surgical removal of the ovaries. Maybe you have conditions such as ovarian cyst, ovarian cancer that can lead to the removal of the ovaries. Yes, the ovaries also play a role in the production of estrogen. So yes, when the estrogen levels drops with that, you will be experiencing vaginal dryness. And there are some medications that are used to lower estrogen levels to help treat a certain condition, such as fibroid and then endometriosis. These medications, because they cause the estrogen levels to drop, it will inadvertently also cause vaginal dryness. Okay. All right, ladies. So let's look at some vaginal disorders. We were looking at the very common ones for lack of time. Okay, we'll talk about things that can affect the vagina. Now, when we say vaginal disorders, we can group them into two broad groups. We have infectious ones and then the non-infectious ones. Under the infectious ones, we have the ones that are sexually transmitted and the ones that are not sexually transmitted. So with the next few slides that we'll be looking at these two groups, the infectious disorders and then the non-infectious disorders. Infections are diseases or disorders that are caused by pathogens or other living organisms, microorganisms. It could be bacterial, fungal, viral, or protozoa, and all these also tend to affect the vagina. There are a lot of infections or disorders that affect the vagina, but for this evening, we'll be looking at the common ones, the ones that are very known to us. We'll be looking at how they are caused, the signs and symptoms, how it is managed, some complications, and some prevention tips. Okay, so let's talk about bacterial vaginosis. You remember we said that there's some living organisms that are already found in the vaginal area and they keep the place. They make the place tidy, they get rid of dead cells and then other things that may be harmful to the vagina. Now, when there are some things that we do that will cause an imbalance in the growth of the microorganisms there. Something like using douches or douches. There are some products they sell on the market. They said you put it in cotton, place the medicine in cotton, insert it into your vagina. It will make the place smell nice, keep the place tight. No, those things are not good for the vagina. They tend to cause the microorganisms to overgrow. And when they overgrow, they exceed a certain limit and start causing problems. So that is how vaginal bacterial vaginosis is caused. When you get bacterial vaginosis, the discharge that is released from the vagina is gray. Some say it's yellowish green, but most typically it's gray and it has a fishy smell. So as a fish, so when you take off your panties, you realize that and the discharge is a lot and it's gray. That's a classic symptom of bacterial vaginosis. Fortunately, bacterial vaginosis can be treated since it's just an overgrowth of the normal bacteria found in the vagina. We use antibiotics. So when you visit the hospital, you'll be given an antibiotic therapy to be taken for a number of days. Please make sure that you take it and make sure that you finished the medication, because when you don't, you tend to make the bacteria there resistant and it will be difficult to treat. The antibiotics that are used can be the form of creams or pastries. Pastries are medical formulations that you insert into the vagina. Abscesses are generally a collection of bacteria and pus. Pus is a form of fluid from the bacteria that builds up right beneath the skin. In the vulvar area, it can occur right with the outer or lower lips or just around the vulvar area. And normally it also occurs around the gland. There's a gland there called the Bartholin's gland. It can occur there. It's basically caused by an infection to the area. Some infections can cause abscesses, and some STIs too can cause abscesses. Another factor that can cause abscess is the ingrown hair. Sometimes when the hair is growing around the area, it grows inwards, and it can cause fluid to be collected in the area and it will be infected as well. Also, when we wax the place, you know what waxing is? You spread this sticky substance there and then you use material to pull the hair off permanently. Yes, that's waxing. And then shaving can cause that. Laser treatment and then piercings in the area can cause a place to be infected and abscesses can occur. The symptoms is there's a swelling. There's a big swelling and then the place becomes very, very sore. Women who have more oily skin are prone to have the abscesses more than those who have less oily skin. Okay, and when you visit the hospital with an abscess, what the doctor will do is to just have a normal physical examination and then diagnose you. The treatment for abscesses are you use a sitz bath. I'll show you what a sitz bath is. It's normally used after delivery to clear the the dead skin tissue from the vagina. I'll show you how it looks like. If you don't have a sitz bath, there's something that we do locally. You take a clean bowl, a clean large bowl, fill it with warm water, not hot water. Add salt to it and some add disinfectant, and then you sit in it. We normally do it after childbirth, to remove excess blood and tissue, yes, from the vaginal area. So locally, that's what we call a sit bath. And then we also use antibiotics to treat abscesses. There's a regimen that we use when you visit the hospital. You'll be given that. Or if it's too big and too painful, we recommend that we drain it. So we make an incision and then drain the abscess, take away the fluid to allow healing quickly. Okay, so let's talk about gonorrhea. Gono, as we commonly call it. I mean, it's a very common STI, I think, worldwide and even in Ghana. I mean, every young person or anyone who is sexually active has an idea of what gonorrhea is. Okay, so gonorrhea is mainly a sexually transmitted infection and it's caused by a bacteria. Some of the symptoms that will present, it normally presents on the 14th day, after 14 days after you've been infected. Okay, so you have painful or burning sensation when urinating. There's increased vaginal discharge, and sometimes the discharge can change color. It could range from white, yellow to green, depending on the individual. And also in women, there could be irregular vaginal bleeding. So you start bleeding in between your periods. Even when it's not time to have your period, you start having some form of bleeding. Yes, that's a symptom of gonorrhea. Now, those who have multiple sexual partners and those who have unprotected sex are more prone to have gonorrhea. But then for us that we are married, we have only one husband, yes, and we know that our husbands have tested negative. They don't have that. We know that we are safe. Yes. Okay, so when you or someone presents with these symptoms, it's necessary that the person visits the hospital. Now, when you visit the hospital, we take a urine sample or a vaginal swab to test for gonorrhea. And gonorrhea can be treated using the right antibiotics and making sure that you take the antibiotics as prescribed. The only way to prevent gonorrhea is to maintain a monogamous relationship and to have protected sex. For those who, I'm trying to sound as professional as I could, but as Christians, we will not be going there. We know that we are protected because we are doing the right thing. Okay, so candidiasis or white, the lady's favorite vaginal disorder, is, I think, is one of the commonest non-STI infection that occur in women. Non-STI because it's not sexually transmitted. And just like the um, bacterial vaginosis, candidiasis is also caused by the imbalance in the microorganisms that are living there. So whilst bacterial vaginosis deals with bacteria, candida or candidiasis deals with the fungi that are found in the vulva or the vaginal area. Okay, so the things that we do that will cause an overgrowth, just like we said in the bacterial vaginosis, are also the same things that can also cause that in candidiasis or white. Also, taking some form of antibiotics, some antibiotics can reduce or increase the growth of the fungi that is found in the vaginal area. Diabetes is one. Diabetes also predisposes you to candidiasis. The urine there is always full of sugar, and it creates a very good environment for the fungal to grow. Okay, that is why most diabetics are prone to candidiasis. And also, if you have a weakened immune system, you are also more at risk of getting candidiasis. The classic symptoms, the itching. It's like I say, masiwa kekame pa, and we will say discharge ne dawson, and a thick about akesi. Someone came to our center and was it? Then a basse clot, a back akesi, discharge ne dawson, and a cano. So when you scratch, it will cause soreness because you can't just keep your legs together. It's very, very itchy. Now the soreness will cause pain as well when having sex and when urinating. So these are some of the classical symptoms of candidiasis. It can be treated. Yes, it can be treated, but it needs to be treated properly. We have antifungal agents that we use. It can be taken orally or you can apply it topically to the area. Please make sure that you take it as prescribed when you have white. And the interesting thing is women who have white are more likely to have it several times in a year. Okay, so good vaginal care, we'll be talking about that tomorrow, God willing, and how to also minimize such infections. Okay, so genital herpes. Right, so let me break it down a bit. Also, how Obeka say, oh, I say me yari menya even from no yari hu, and I say when ya a krobi one ano, there's this form of blisters that is formed around the mouth when you are stressed or you have a weak immune system. Now, these same blisters can also occur at the vulva or vaginal area, and when it's found there, it's called genital herpes. The virus that causes it is called herpes simplex. The difference is that the one that causes the blisters around the mouth is called type 1, and the one that causes the blisters in the genital area is called type 2. Now, when you are infected with this virus, you show one or more painful blisters. There's a small swelling that is filled with fluid. Yes, and it's painful. And when you burst it, it becomes sore. Also, you'll be experiencing flu-like symptoms like body ache, cold, fever. Yes, those are symptoms associated with viral diseases. Just like any other STI, genital herpes is caused, or you stand a higher risk of getting it when you have multiple sexual partners or when you have unprotected sex. Now, when you present with such blisters, you have to go to the hospital, and there we'll do further medical examination and then blood tests to test for antibodies present in your blood. Unfortunately, genital herpes, it has no cure. Once it's in your body, it stays there. What we do is we give medication to manage the symptoms so that you become asymptomatic, or you wouldn't have any symptoms. But the virus remains there with you for life. So whenever you have your immune system becomes weakened, or there's stress, or you come into contact again, it will start showing symptoms. You can't cure it. It's there with you. For women, there are some complications because once you are infected with the herpes virus, you can transfer it to your unborn child or your newborn during delivery, and that is fatal for the baby when he or she is delivered. Just like all other STIs, remaining faithful, having a monogamous relationship, and then having protected sex can help prevent against herpes in the genitalia. Okay, so the next infection is trichomoniasis, or some people call it trich, however you want to call it, it's acceptable. Okay, so it's also a sexually transmitted disease. That means you get it from having a sexual relation with someone who is infected with the disease. It's not a bacteria, neither is it a fungal or viral. It is caused by a protozoa. That's another form of living organism. Okay. Now, when you are infected with trich, you experience itching. Yes. Now, when you scratch the place will become sore, and then you have a burning sensation when you are urinating or when you are having sexual intercourse. Also, the vaginal discharge changes. You have an increased vaginal discharge, and the color can change. It can be from clear to yellow to greenish, and it usually has a very fishy smell. So all these come into play when you have the disease. We normally do laboratory tests to test for the presence of the protozoa in your bloodstream. Unfortunately, it can be treated. So a good antibiotic using the right therapy regimen, you will be cured. When left untreated, you stand higher risk of contracting other STIs. And then also for women that we are more interested in pregnancy, when you are diagnosed with the disease, you are likely to have a low birth weight. That means the child, when born, will have a lower weight, more and less than the usual. Okay, all right. Okay, so let's talk about us a bit. In our bid to clean the place, make the place smell nice, we are helping the vagina to keep up with keeping the place clean. We end up using certain things like soaps, fabrics, perfume. I know some people who even spray the place. You put powder there. You use certain soaps to clean the place. You take certain materials, cotton, cloth, something just to make the place nice. And unfortunately, these things tend to irritate the delicate skin on the vulva or the vagina. As we said earlier on, the vagina is self-sustaining. It has every mechanism in place to keep itself clean. So whenever you use such materials there, you tend to disrupt the conditions there, then you become prone to certain infections and certain disorders. Now, some soaps are so harsh, some fabrics are so harsh that they cause the place to burn and sting you. Then you end up itching and then you end up having pain there. Please, let's try and put a stop to that. So, what you can do is when, let's say, peradventure you do that and the place becomes sore or the place becomes very painful to touch, just take an ice pack. Okay, you can put ice in a soft cloth and then put it there gently just to cool the place, okay, and help reduce the pain and then the irritation. Then you can apply a thin layer of petroleum jelly, or you can use shea butter. Just rub it gently within your fingers and then apply it there nicely just to help lubricate the place and then to prevent the place from becoming too dry and sting you. In severe cases, we might give some medication to help the soreness there to heal better. So please, let's try and avoid putting foreign materials there. Please don't do that. Please, we are begging you, don't do that. Keep the place clean, nice. Use your nice clean hands and then a mild soap. Wash the place. Don't insert your hand into your vagina. No, please don't do that. You rather end up putting or introducing foreign materials into your vagina and rather causing more harm than good. Just wash the skin in between the flaps. Wash it gently, nice warm water. Dab it dry with your towel. You don't need to insert your towel inside, okay? Clean the place gently. Keep it nice. God willing, tomorrow we will talk more about how to keep the place clean, nice, and healthy to prevent such disorders.